That nice introduction. That's kind of weird to say. I don't hear many Shelbys, so thanks Shelby for introducing me.
Mhm.
Um, as she mentioned, my name's Shelby Brueck, and I'm going to be presenting on building trust, rapport, and partnerships to best serve American Indian populations. Shelby also went through the learning objectives, but just to break it down a little more specific, we'll identify some strategies on building trust rapport within American Indian communities. And I hope by the end that you all will have an understanding on how different ways of building personal connections and how that can help bridge a gap between American Indian communities and health services. And as I'll mention throughout the presentation, there is no one way to do any of this. And I'll just be sharing a lot of my own experiences and learnings. And then also recognizing some key strategies and challenges when developing culturally adapted public health interventions. So before I jump into kind of the meat of the presentation, I just wanted to share NHBP's logo. So this is what we call the abbreviated logo on the screen here. And the turtle itself represents several things for the NHBP community. And I just felt like it was really important. This is something that's kind of been instilled in me since my beginning of time here with NHBP, is different elements within this turtle. So if you see the turtle's head, that represents the lower peninsula of Michigan, where the Nottawaseppi people are from. And then the teal H that runs through the center of that turtle is for the Huron band. And then there's several other little things that have a significance within this community. But the part that I really want to point out is those 7 circles within the center of that turtle. And those 7 circles represent the 7 grandfather teachings. These 7 grandfather teachings originate from the Anishinaabe culture, and their roots date back to the beginning of time. These teachings represent or impact our surroundings, along with providing us some guidance on how we should like treat others and our actions towards others. And NHBP has made these 7 grandfathers their code of ethics. So when we onboard as new employees, this is the code of ethics that is presented to us, is those 7 grandfather teachings and what they mean for NHBP. So I learned about it in my orientation, and now I'll kind of talk about my journey here with NHBP. But it's something that we work with our teams, our staff members on a daily basis. So those 7 grandfather teachings are love, bravery, honesty, wisdom, humility, respect, and truth. So then a little bit about myself. I know within the Native communities, something that I have learned is a way of teaching something is storytelling. So I just want to start with a little bit of background about myself. So I am from Southern Michigan. I'm married to a farmer, and I'm blessed to have these 3 little kids that you see on the screen. And I work for NHBP as their community health outreach manager. I've been with the tribe for just over 9 years now, and I started my journey here as a health educator. And then 3 years ago, I moved into this new role as the community health outreach manager. And I do think it's important that I share that I am non-native. I think it's going to play into some of the different approaches that I have taken that you'll get to see throughout the presentation today. And then I have an understanding and knowing that some Native Americans can have a mistrust in outsiders or non-natives, and that's due to a long-standing history of broken promises, and also those outsiders coming into communities, especially people in positions of authority, and they're making decisions that they feel are of the best interest for American Indians, but without really getting to know those community members and getting their input. So they're making decisions on behalf of them. So we get that there can be a mistrust. So that's one thing that has played a part in my journey. But I did just want to share that I am non-native working within a native community. So I grew up in a town called Scotts, Michigan. It's roughly, and you can kind of see on the map here, it's roughly 14 miles from the Pine Creek Reservation. And growing up, I never knew about the tribe. I didn't know it existed. I didn't know where it was located. I wasn't taught about it in school. I even attended school in my same class with an NHBP tribal member, and I had no idea. um a story for a different time, but that individual actually went on to being my boss for a little while, and we went through our master's program together. So small world, but so close, as you can see in this map, 14 miles, and I had no idea and no understanding of Native culture. So when I was working as a health educator, when I first started here, I started to have more of a passion for public health. And I went on and got my master's degree in public health so that I could better support the growing needs of the tribal community from a public health, community health standpoint. And when I started in 2016, I felt this like hesitancy towards me from some community members. And I heard stories when I first started of staff turnover. And looking back, like when I was in that moment, I didn't understand it. I'm like, what? But looking back now, I understand that hesitancy. And honestly, I can respect that hesitancy. Um, because and also at first I didn't understand it because I was like, I feel like I'm an approachable person. But now I understand it. And like I said, I can respect it. I listened to people's stories and learned about the historical trauma that either some of them had went through themselves or their family members, um, things that they had came through. And I was able to understand that hesitancy. And like I said, now I can respect that and appreciate that hesitancy. So when I was putting together this presentation, I shared it with some tribal members and asked for their input. And one thing that one of them brought to me was, I really think you should draw out some sort of timeline. And of course, when we're talking over 9 years, to try to put that kind of stuff on a timeline, that was going to get super busy. So I just wanted to give like a brief overview of some of the things that have taken place with my time here. And another thing too is you'll right now it probably feels like I don't want it to seem like that, because in all of my efforts, like none of this could have been done alone, and it couldn't have been done with support from tribal members or certain mentors that I've had throughout my time here. So different things that I have taken part in or been a part of, both with my journey as a health educator and now in my management position, is organizing and leading something like a lunch and learn program. And the thing that I took away with that is people were hesitant at first of me showing up for that program. And the thing I was hearing was, how soon is she going to leave? When is someone else going to take her position? Like, are you going to be back next week? And so the thing I took away with that is you got to keep showing up. And you will build some relationships. So lunch and learn was an example. Walking around the reservation with elders, just basically being out within the community, coaching Girls on the Run or any school programs, taking youth to summer camps. I've visited members in hospitals, and then helped with different programming and events. And then with all of that came invitations to tribal members' weddings, phone calls outside of normal business hours, attending birthday parties, and becoming part of these people's family, essentially. And then also you get to know people so well. There is, the unfortunate side of it is people pass away, and there's been many funerals that I have attended. So I have over my time here have felt, part of some people's family. So that's just a little bit of my journey. So now I know several of you probably jumped on this webinar saying like, okay, maybe she has this, figured out. She's going to share this roadmap to building trust, rapport, and partnerships. Give us, I want to come here and hand me this how to. How do I do it? Just tell me how to do it. So I kind of wanted to share this map with you. But simply put, there isn't one. So a lot of times we have a starting point. And then we all know that building these relationships is going to take time, and it can be done in many different ways. So this is the roadmap. So, and I know everyone's muted, so hopefully someone got a little bit of a laugh out of that. But basically, there is no roadmap. You're going to be on this journey a long time. So similar to the image here, you have a starting point. You're going to try different things. You're going to put in a lot of time and effort and energy, but your work is never really done. And this is whether you're native or non-native. Like, even I've heard when I've done this presentation before, and I had some native individuals listen to the presentation, and they said, it really resonated with me, and I'm a native working even within my own community. And to build trust with certain people, it takes time and energy, and sometimes you fail, sometimes you succeed. So it doesn't matter who you are, but if your journey is never going to end unless you stop putting in the effort. So I would like to zoom in on a piece of this journey that I've been on this roadmap, and show you that mistakes can take place. They do take place. Things take time. And like I said, sometimes you're going to see success. Sometimes you feel like you won't, but I feel like if you put in the effort, you're always going to be learning. So the first kind of piece that I want to touch on is a program that we have here at NHBP called the Elders Hospitalization Gift Card Program. And the point of this is I don't want to necessarily teach you the ins and outs of this program, just to teach you about like basically some things that I did like and learned from, made mistakes. So the background info on this program is that when an elder is hospitalized, they receive a $25 gift card if they notify us. So this program was created by the Elders Committee. It was a very informal program to support elders, whether they were hospitalized for injury or illness. So very informal when it started by the Elders Committee. In 2012, the program was transferred from the Elders Committee to the Health Department due to some HIPAA concerns. There wasn't really any HIPAA concerns, but they just wanted to make sure they were doing right for their people and making sure they were keeping someone's information confidential. So the smart move was to move it to the Health Department. And then in 2019, the program started to be administered by our community health reps. And then this is when I started to come into play in this management position. And in 2022, we started to look at the program, and it was very underutilized. We were only having maybe a couple elders a year take advantage of this program. And we're like, do we keep advertising it? Do we keep this program? The staff and I looked it over, and we decided that we wanted to request that the program be terminated and any funds that were set aside for it be allocated somewhere else. So we presented this to council, and council decided, no, the program needs to stay, but you can make improvements on it. So then we had to kind of go back to the drawing board and figure out how could we get more people utilizing it. And I think the intentions when we looked back on it were the CHRs, we wanted them to really connect with the individual and see if they could offer support. So we started to make some improvements, and we wanted to focus more on building that connection. This gives us an opportunity to say, this person's hospitalized, let's see how we can assist them and help them. So we put more of a focus on building that connection and linking that individual with services. So now I just want to walk you through what this process can look like. So, and I'll get to a slide on like what the lessons were learned throughout this journey, but here's the program in action. So an NHBP elder notified us of a hospital stay. At the time, we did not have a CHR on the reservation, so I took on contacting this elder. The current elder did not use any of our health services, and there was kind of a hesitancy there to use our services, worried about privacy and that sort of thing. And so I called the elder, told him I had this gift card for him, and asked if I could come deliver it. So I went over to the elder's house, delivered the gift card, and discussed the ways in which we could serve this elder. And there was a couple things that they were eligible for. We didn't have the CHR at the time, so I couldn't necessarily offer those services, but we did have a chore provider. And so this chore provider can go on into elders' homes on the reservation and provide some light housekeeping, laundry, meal prep. And so I told this elder about those services and she was interested. So our chore provider started services with them. And then throughout that time when the chore provider was providing the services, this elder became a little more sick and it started to have more medical issues and decided we then had a CHR on board that she wanted to utilize the CHR services. So we get the CHR and her connected, and now we're heavily involved. We even have our clinic team working with this elder. One of our providers was doing home visits. It was like a daily interaction between this elder and someone from the health department. So heavily involved. And then unfortunately, this elder walked on. And I know that's a very short synopsis of the situation, but the family was so appreciative of the services that the health department provided to her that even in her like obituary and in her program at her funeral, they recognized the health department and all of their services. And the chore provider and CHR, which are both on the community health team underneath me, um, have just stayed close with this family, and this family has really built a connection with them. And it all started with how they described it is get someone getting up from behind their desk and talking to the elder, someone that was not on board with the services, and just being there for them. And so the family gave me permission to share her picture to honor her. And so we really miss her, and we still see the family still connects with us, and they are so thankful of the services that they received. So some lessons learned. First of all, ask questions and get to know the purpose. In this case, what was the purpose of the program? That's something that I did not take the time. I just kind of listened to, oh, it's underutilized. Why do we still have this program? Where there was improvements to be made, and those simple improvements of really making a connection with someone when we get the call for a gift card, use that as a time to get to know them and build a relationship. So when it's not being utilized, figure out the why. And then make those personal connections. I've heard the feedback that face to face is best, but if it needs to be a phone call, that's fine. But when you can make those face to face interactions, and then never give up on building a relationship with someone, sometimes it can take years. So the elder that has walked on, she was always involved with the community and like our lunch and learn program, but never with direct services in the health department until she had a significant need and she found that we could support her. And so it was, she had access to the health department for years, but didn't utilize it because she didn't, at the time didn't have a need. So just never give up because you never know when someone's going to need you. So then the next example I would like to share is more policy related. So we have a nutrition policy here at NHBP, and how that kind of started was there was specific members of our health department that had a strong desire to see more nutritious meals offered at programs and events. So the health department decided to draft a government-wide policy. And I know I can't see many faces and you guys are on mute, but I thought when I presented this in person, I was like, wait, no one throw anything at me. Because when I say it, all of this out loud, it's like, what were you thinking? But yes, so the health department decides to draft a government-wide policy. And we added this draft policy to a leadership meeting agenda to discuss with the rest of members of leadership. And at the time, it was just a bad timing thing. There was not a representative from the health department that could be present at that leadership meeting that it was being presented on. So the policy task force presented it. And leadership was not in support of this policy. And there was lots of pushback and lots of questions, and we weren't there to answer those questions. So it basically got shut down right there. And the health department decided that we would just make this an internal policy then and not a government-wide policy, because that's where the only place we had control. And at the beginning of this process, the community health team was collaborating with other departments more for programming, and we were seeing that meals that were being offered, and they just weren't balanced. And we would hear it from community members, like we get pizza at certain programming, which pizza is great, but it's not a balanced meal. And so there was a desire from the community for a balanced meal, but when you put it in policy, that can really steer someone the wrong way. And also when you're talking about food, food is a big part of a lot of cultures. But here at NHBP, food, I mean, it brings people together. And if you're going to put a policy around requirements and stipulations on what can be offered, of course, there's going to be some hesitancy. So our food sovereignty program was really starting to develop during all of this. And they were getting lots of engagement and excitement from community members. And something I found really interesting, and this is a picture that I wanted to share, was during all of this, this is our food sovereignty coordinator, and this is one of her tables at, I think this was a New Year's Eve powwow, possibly. And if you look close, I know it's probably hard to tell, but on her table is healthy snacks that she was giving out. So like applesauce, apples, bananas. And so there is that desire there to give out nutritious food. And a lot of times we already saw these different departments were making a lot of steps in the right direction. But when we threw a policy together, it was nixed. And the part, and I'll go to lessons learned, is we didn't get buy-in from the other departments. We were just like, yep, here's this policy that got shut down. So lessons learned with all of this are, before you throw a policy at anyone, start a discussion among departments and staff and get their thoughts and feelings around this topic before you draft a policy. We knew that other departments and staff, they wanted education on offering healthier meals. They were even asking for us to come into the community and provide them education on what a balanced meal looks like. And they were doing a lot of the work before, or what our policy stated. They were already doing a lot of that work without a policy being in place. So we were kind of pushing our agenda on them. And then a big thing that I like to say is nothing about them without them. So get the community's input on what they want. Don't make the decision for them. Collaborate with other departments, and it's okay, gently educate them. Get them on board with the idea or the change before that policy is just thrown out there. And then I always like to kind of think of this with any sort of change, is think of a child when they're taking their first steps. When they first do this, they might only take one step and then they fall. But we get super excited and we're like, okay, get up, keep trying, like you got this. We're rooting them on, cheering them on. We should do that same thing when we see these little wins or small changes among the people in the communities that we're working with or trying to collaborate with. So it takes time, but baby steps are okay. And believe me, I have to remind myself about that in several different aspects of life every day. So again, when I'm meeting with tribal members, and I wanted to get some of their insights, so I asked them a couple questions. And one question was, what do you think needs to happen or should happen for someone to build trust, rapport in the community? And some of the things that they shared with me were: be genuine, be yourself, be honest and open, be cautious of your words, because we all know that words can hurt or people can interpret them differently. So be cautious of your words. Share your story and be relatable. Someone told me, don't be afraid to show your emotion. I did have someone say, but don't overdo it. And then know that building trust, it can take time. In the past, it was broken so many times. So it's going to take time. And then one big thing that kept coming up was just listen. Just listen. Sometimes that's all they need. And so then a bit more, I wanted to dig a little bit deeper. And so I said, is there anything different that you would need from a non-native working within the community to build trust and rapport with them? And got a couple different answers. And someone said it really shouldn't be different. But if the person is native, we feel that they know or they should know what we've been through. They understand us. So for non natives, it can take some time to build that relationship. And then someone else shared with me, know that we aren't a business, we're a family. And then also, just again, face to face interactions are so important. And they were saying that, just get up behind the desk, get out in the community. The more we see your face, the more that we're going to get to know you. We're going to get to know you showing up. So, face to face as much as possible. So, then how can we relate all of this back to public health? And some things I mentioned through the presentation and the different examples I gave might have been obvious as to how it all relates to public health. But the overall concept that I see is whether you're working within a tribal community or you're looking to develop a partnership with a tribal community, the first step should be building trust. Use that as your foundation to foster engagement and collaboration. And then hopefully you will see positive health improvements and outcomes. And be humble and always meet the community where they're at. And then if you're in a leadership position, and I don't mean just like a manager, a supervisor, director, you can be a leader to your peers and to your coworkers. Always lead by example. And then something I always like to keep with me is I would not make my team do something that I wouldn't do. So just as a leader, if it's something I wasn't willing to do, I'm not going to make someone else do that. And then a question that I like to ask people during interviews is how they would go about building trust and rapport with people they don't know and people from different cultures than theirs. Because it does, like my thing there is you got to hire people that are going to fit within the community. It is a very different place to work. And so personality and that sort of thing does play a factor in it. And then the other thing is you don't have to do it all, but you can always connect someone with the right individual, the right person that can help them. So while building individual trust is important, it also means a team approach is helpful. So you don't have to do it all. And believe me, I have a whole team of 10 people. I don't do it all. I have them to help me out. And so even if it's just me helping make that connection to someone on my team, they can take it from there. They become the support person, the go-to. So you need a team effort. And then if you say you're going to do something, follow through with it, because that's another way that the community is going to trust you. So then, oops, I don't know why. Okay. So the road, just remember this, the road might be long, hard, tiring, and it never ends unless you stop putting in the effort. So just some different things here. There's that roadmap again. So if this means make the chairperson some cookies, dress like a pancake for a Flapjack Friday event, snuggle a baby while mom has a medical appointment, coach tribal youth, get outside and exercise with members of the community, or even help a tribal member present for the first time. All those little things matter. So building trust, rapport, and partnerships is not easy, and it's not done in one way. So I encourage you all to take the time to ask the people you're working with what they need from you to be able to work together. Don't assume what they want and don't push your agenda on them. Support theirs. And I think that's all I have, but I love conversation and different people's experiences. So please share.
If anybody has any questions for Shelby, feel free to come off mute and ask away, or if you have any comments, go ahead and you can say those right now.
Chimugwit, Shelby, that was a good presentation. I'm Danny, I'm a person in long-term recovery, and I work down in Shiawassee County for Peer 360 Recovery Alliance. And we do some work up in Mount Pleasant on the reservation. And actually one of our county coordinators is Native American. And so she lives right on the res. And I just want to say our experience has been just really amazing. We've been really welcomed in. I take on like a curiosity and want to learn about the Native American culture. It really resonates with me with the nature and the closeness of community. And I just was curious. I don't know. I think it's important, like working with the community and having them be a part in like the things that we do, sorry, my cat loves to Zoom with me. So I found anyway from our experience, I don't want to speak for everyone, but in our organization, even because, Anna does a whole lot of stuff up in Mount Pleasant. I go up on occasion. I'm not as able to go as often as I would like to now, but I know working with the community is huge and taking cues from the community on what they want, like you kind of mentioned, not just going in with your own agenda. So I just wanted to express that it is a really amazing privilege. I look at it as a privilege. So thank you. Good presentation.
Thank you. Yeah, that's one thing that I always tell my team. I have tribal members and non-natives within the community health team. And that's one thing I always think about is, yeah, it's a privilege. They're giving me this opportunity to work here. And so I always take it like that, like a privilege, like you mentioned.
Hi, Shelby. I think that it was just really hit hard to me too, that I hadn't really put a lot of merit in is the staff turnover. And just that's another way that trust has been broken repeatedly with the community. And so just to be able to build that back, being consistent and being there, but just even looking at our teams and trying to maintain those teams as much as possible and having that consistency there too. So I guess I hadn't really thought about that perspective before, and I really appreciate that you brought that forward today.
Thank you.
Are there any last minute questions or comments? If not, I'm going to drop a link in the chat, and that is if everybody could fill out the evaluation form, and that will be how you get your CEUs. Thank you everybody for your time. We appreciate having everybody here today with us.
Thank you all.
Miigwech, Mama.